Hello everyone, Josh Bruce here for Smart Tools, along with my good friend and magical manual therapist, Sean Brock here.
Hi.
We're doing a quick little video on how we do some assessment and treatment for plantar fasciitis here in the clinic, including use of the Smart Tools. Obviously, with any injury, we're going to start with the history, visual, then we'll move on to visual inspection. So I'm going to look through the foot, top of the foot, knees, see if there's any evidence of trauma, bruising, swelling, things that might affect the treatment I'm going to do. Obviously, we're going to palpate along the plantar aponeurosis, looking for tenderness through the plantar fascia. All right. Check range of motion through the ankle in the dorsiflexion. All right. We'll check inversion and eversion as well. Always want to look and assess range of motion through the great toe joint here. All right. I have plenty of range of motion through there. As far as palpation, I also want to take a look at some of the other muscles that help to support the arch. So one of my favorites is to take a look right here. I'm going to have Sean bend his knee, and we're looking through the posterior tibialis and check for tenderness. Ouch. And you can tell by Sean's face we got a little bit of activity to do through here. Check to the tibialis anterior as well. A little bit of tension, not as bad, and we'll go through. All right. Next, Sean, I'm going to have you go ahead and actually flip over for me too, please. Okay. And then because our gastroc, soleus, and the Achilles tendon are in series, if you will, with the plantar aponeurosis, plantar fascia, we're going to check through for tension through these muscles as well. And finding some tension here and through here. We'll also do a little bit of treatment through the calf. All right, so we're going to go ahead and do treatment through the plantar aspect of the foot. As with all of our treatment protocols, we're going to start with the scanning. I'm going to go ahead and do scanning through the whole foot while I'm here, check for any of the restrictions while I'm treating through the area. Take our tongue depressor, a little bit of our smart cream, not too much. Lay some of that on there. All right. Grab the scanner, and we're just going to do a couple of passes here in all directions. Try not to make it too ticklish. All right, check this way. And I'm finding a little bit more restriction along this direction, so we're going to work this way with the treatment. All right. All right, so now we're going to go ahead and do our treatment passes with the Smart Tool here. I've got my sharp. We're going to work along edge 1. Just a reminder, this area can be pretty sensitive, so you don't want to start super aggressive. We're going to start light and then increase our pressure to patient tolerance. So Sean, I'm going to have you kind of curl your toes down here. I'm going to add pressure with the tool, and then you're going to extend your toes up as we work through. All right, good. We'll go ahead and do a few passes there. Working through the plantar surface. And while I'm here, I'm also going to work through the medial surface as well. Getting that abductor hallucis and some of the flexor hallucis muscles and tendons as well. One more. Good. All right, so if you remember from earlier when we were doing our palpation, Sean had quite a bit of tenderness to the posterior tibialis here. So I've got everybody's favorite tool, Captain Hook. And we're going to go ahead and do some pin and stretch maneuver along that muscle to help make sure that's functioning well. All right. So this we're going to do kind of a J motion. You can kind of sweep up and out that direction while I add tension here. All right. Good. So go ahead and relax. Put some tension and go ahead and sweep. Good. Back and go ahead. How's that pressure? That's good. Okay. And we're going to work our way up the belly of the muscle, all the way through, releasing some of the tension, hopefully helping that muscle function a little better. Last one here. All right, so now we're going to go ahead and focus on the posterior part of the ankle here. We're going to scan through the Achilles tendon and the calf. So we'll go ahead and ice the cake here. The emollient down. Grab the scanner and see what we have. Feeling that there? Okay, and then we'll switch directions. And that seems to glide a little easier, so we're going to work approximately when we do the treatment passes. All right. Check down along the Achilles. A little bit right there. And that's scanning through. For treatment down along the Achilles, again, we don't expect to make a ton of mechanical changes working directly along the tendon. So we tend to focus more of our effort just to the side, lateral, medial portions along where the Achilles tendon might glide past some other tissues. All right. So first, I'm going to kind of clear the path through here, working all directions. Again, starting lighter and increasing pressure as tolerated. All right. Work through the medial side here. Okay, now Sean, I want you to go ahead and add a little bit of motion for me here. Yeah, exactly. Have you go plantar flexion, dorsiflexion, and we'll work right in through there. All right, go ahead. And back. And go ahead. Good. Back. Go ahead. Awesome. Couple passes on this side. Don't forget to breathe. Perfect. So an often overlooked part of the treatment for plantar fasciitis is what's going on in the hip. We've got a lot of powerful muscles through the hip, and they can have a big effect on the positioning of your foot, the control, the rate of loading through your plantar fascia as we're moving, walking, and jumping. So I've already scanned through his hip. We're going to go ahead and do a little treatment and work through that posterior lateral musculature of his hip. So we're working through the posterior chain here. Good. And yeah, a little bit of movement through the knee. Go ahead and let it drop down. Perfect. And back up. And drop down. Couple here. Last but not least here for our treatment, we're going to go ahead and work through the posterior calf musculature. All right, we have the handlebar tool here, which is great for large muscle groups. We're going to start more gentle here on the concave side, and then after we've done a few passes, we're going to work through, be a little more specific, a little more aggressive with the convex side. All right, so same motions we did through the ankle. I want you to go through plantar flexion and dorsiflexion here as I move through. All right, and go ahead. Good. Keep working. Keep breathing. Perfect. One more pass there. Good. You have for a little more pressure? Mm-hmm. All right, here we go. Convex side, go ahead. And as we loosen up this musculature, this should help to take stress off of the plantar fascia, plantar aponeurosis, through the pressure on the calcaneus. All right, that concludes our video on brief assessment and treatment involving plantar fasciitis. We'll be back shortly with another video on some of the corrective exercises and treatments I might do to add on to the soft tissue treatment.